Rescue breathing is a technique for breathing air into a person to give her the oxygen needed to survive.
1,000, 2 1,000, 3 1,000. 1,000, 2 1,000, 3 1,000.
During the initial assessment, if you find that an unconscious victim has a pulse but is not moving or breathing, begin rescue breathing. Position the resuscitation mask. Tilt the head back and lift the jaw to open the airway.
1,000, 2 1,000.
Take a breath before you give each rescue breath.
1,000, 2 1,000, 3 1,000. 1,000.
Give one rescue breath about every 5 seconds.
1,000, 2 1,000, 3 1,000.
Each rescue breath should last about 1 second and make the chest clearly rise.
1,000, 2 1,000, 3 1,000.
Breathing too hard or too long can force air into the stomach, causing gastric distension.
1,000, 2 1,000, 3 1,000. 1,000, 2 1,000, 3 1,000. 1,000, 2 1,000.
After 2 minutes of rescue breathing, remove the resuscitation mask. Look for movement and recheck for breathing and a pulse for no more than 10 seconds.
1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000.
If the victim has a pulse but is not moving or breathing, replace the resuscitation mask and continue rescue breathing. One rescue breath about every 5 seconds.
1,000, 2 1,000, 3 1,000. 1,000, 2 1,000.
Look for movement and recheck for breathing and a pulse about every 2 minutes.
6 1,000, 7 1,000.
Continue rescue breathing until the victim begins to breathe on her own, until another trained rescuer arrives and takes over, until the scene becomes unsafe, or until you are too exhausted to continue. If you must leave the scene, or if during care you find movement, breathing, and a pulse, but the victim is still unconscious, place the victim in a recovery position. Continue to monitor the ABCs. During a pulse check, if you find that the victim has no pulse, begin CPR. You will learn how to perform CPR later in this course.
1,000, 2 1,000, 3 1,000. 1,000, 2 1,000.
One 1,000.
Rescue breathing for a child is the same as rescue breathing for an adult, except that you need to give more breaths per minute. Give one rescue breath about every 3 seconds.
1,000. 1,000. 1,000. 1,000. 1,000.
Remember that a child's airway should be open slightly past the neutral position. Each rescue breath should last about 1 second and make the chest clearly rise.
1,000. 1,000.
As you did for an adult, look for movement and recheck for breathing and a pulse about every 2 minutes.
1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000.
If the child has a pulse, but there is no movement or breathing, replace the resuscitation mask and continue rescue breathing. One breath about every 3 seconds. Rescue breathing for an infant is the same as for a child. One rescue breath about every 3 seconds.
1,000. 1,000. 1,000.
Each breath should last about 1 second and make the chest clearly rise.
1,000. 1,000. 1,000.
Use a pediatric resuscitation mask on an infant, but if a pediatric mask is not available, reverse the direction of an adult resuscitation mask, placing the nose of the mask on the infant's chin.
1,000. 1,000. 1,000.
And remember to keep an infant's head in a neutral position to maintain an open airway.
1,000.
Look for movement and recheck for breathing and a brachial pulse about every 2 minutes.
1,000. 2 1,000. 3 1,000.
1,000.
To review,
1,000. 3 1,000.
during the initial assessment, if you find that an unconscious victim has a pulse but there is no movement or breathing, begin rescue breathing. Position the resuscitation mask. Open the airway. And give one breath about every 5 seconds.
1 1,000. 2 1,000. 3 1,000. 1 1,000. 2 1,000. 3 1,000.
Each breath should last about 1 second and make the chest clearly rise.
2 1,000. 3 1,000. 1 1,000. 2 1,000. 3 1,000.
For a child or infant, give one rescue breath about every 3 seconds. Look for movement and recheck for breathing and a pulse about every 2 minutes.
9 1,000.
Continue rescue breathing until the victim begins breathing on his or her own, until another trained rescuer arrives and takes over, until the scene becomes unsafe, or until you are too exhausted to continue.
1 1,000. 2 1,000. 3 1,000.
1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000.
Victim has a pulse but is not breathing.
A bag valve mask resuscitator, also called a BVM, is a handheld device primarily used to ventilate victims who are in respiratory arrest. It can also be used for victims in respiratory distress. A BVM increases oxygen levels in the blood by using air in the surrounding environment instead of air exhaled by the rescuer. Because it's necessary to maintain a tight seal on the mask, 2 rescuers should operate the BVM. One rescuer positions and seals the mask, while the second rescuer squeezes the bag. BVMs come in different shapes and styles, but they all have the same essential parts. A resuscitation mask with a one-way valve, and a self-inflating bag. Some BVMs come with a valve already attached. If not, you'll have to attach the valve to the bag. There are some BVMs designed specifically for children and infants.
1 1,000, 2 1,000, 3
To use a
1,000,
BVM,
4 1,000,
Rescuer
5
1
1,000,
performs an initial
6 1,000,
assessment,
7 1,000,
while Rescuer
8
2
1,000,
assembles the
9
BVM.
1,000, 10 1,000.
Victim has a
Rescuer
pulse,
1
not
positions the
breathing.
mask so that it covers the victim's mouth and nose, presses firmly on the mask to ensure a complete seal, and opens the airway. Rescuer 2 squeezes the bag to give ventilations.
1,000, 2 1,000, 3 1,000, 4 1,000. 1 1,000, 2 1,000, 3 1,000.
Give
4
one
1,000.
ventilation about every 5 seconds.
1 1,000, 2 1,000, 3 1,000, 4 1,000.
Squeeze the bag slowly for about 1 second,
1
using
1,000,
just
2
enough force
1,000,
to make the
3
chest
1,000,
clearly
4
rise.
1,000. 1 1,000, 2 1,000.
Watch
3
the chest
1,000,
rise
4
with each
1,000.
ventilation.
1 1,000, 2 1,000, 3 1,000.
About every
4
2 minutes,
1,000.
remove the BVM. Look for movement and recheck for
1,000,
breathing
2
and a
1,000,
pulse for
3
no more than
1,000,
10
4
seconds.
1,000.
Stop ventilations.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000.
If there is a pulse, but still no movement or breathing, resume ventilations.
9, 1,000, 10, 1,000.
Victim has a pulse, but it's not breathing.
One 1,000, 2 1,000, 3 1,000, 4 1,000.
1 1,000, 2 1,000. 1 1,000, 2 1,000. 1 1,000.
For a child, give one ventilation about every 3 seconds.
2 1,000.
Squeeze the bag slowly for about 1 second, using just enough force to make the chest clearly rise.
2 1,000.
1 1,000, 2 1,000. 1 1,000, 2 1,000.
For an infant, also give one ventilation about every 3 seconds.
1 1,000, 2 1,000.
Squeeze the bag slowly for about 1 second, using just enough force to make the chest clearly rise.
2 1,000. 1 1,000, 2.
To review,
1, 1,000, 2, 1,000, 3, 1,000.
to use a BVM,
8, 1,000,
assemble the
9,
BVM.
1,000, 10, 1,000.
Position and seal the mask. Open the airway. Begin ventilations.
1 1,000, 2 1,000, 3 1,000, 4 1,000.
For an adult, give one
1
ventilation
1,000,
about
2
every
1,000,
5
3
seconds.
1,000, 4 1,000. 1 1,000, 2 1,000, 3 1,000, 4 1,000.
1 1,000, 2 1,000.
For a child or infant, give
1
one
1,000, 2
ventilation
1,000.
about every 3
1
seconds.
1,000, 2 1,000.
Each ventilation should last about 1 second and make the chest clearly rise.
2 1,000. 1 1,000, 2 1,000.
Look for movement and
1
recheck for
1,000,
breathing
2
and a pulse
1,000,
about
3
every 2
1,000,
minutes.
4 1,000.
Stop ventilations.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000.
An obstructed airway, or choking, is the most common cause of respiratory emergency. First, determine if the victim is choking. If the victim is coughing forcefully, he is still getting oxygen. Encourage him to keep coughing.
Keep coughing.
When a conscious victim can no longer cough, speak, or breathe, he may be choking. Summon EMS personnel and obtain consent.
Greg, call 911. We have a choking emergency. I'm a trained professional. May I help you?
First, give 5 back blows to help push the object out of the airway. Position yourself slightly behind the victim. Provide support by placing one arm diagonally across the chest and have the victim lean forward. With the heel of your other hand, firmly strike the victim 5 times between the shoulder blades. Each back blow should be a distinct attempt to dislodge the object. If the back blows do not dislodge the object, give 5 abdominal thrusts. Use one hand to find the navel. Place the thumb side of your fist against the middle of the victim's abdomen, just above the navel. Grab your fist with your other hand and give 5 quick upward thrusts into the abdomen. Each abdominal thrust should be a distinct attempt to dislodge the object. Continue giving 5 back blows and 5 abdominal thrusts until the object is forced out, until the victim starts to cough, speak, or breathe on his own, or until the victim becomes unconscious. If the victim is obviously pregnant, known to be pregnant, or too large for your arms to reach around, do not give abdominal thrusts. Give 5 chest thrusts instead. For a pregnant victim, adjust your hand position to be slightly higher on the center of the victim's chest. Care for a conscious choking child using the same technique as you would for an